Why is it so bad to have high blood sugars? This is a common question I get because a lot of you guys are getting information that is not correct. So, right, you're getting information from whoever. It could be your diabetes educators, it could be your physicians, it could be your friends, and or whatever. And you're getting information that if you're doing a blood sugar reading or you have an A1C of a certain point, a certain level, you are being told that it's totally okay. Well, we're going to go over that tonight. And because, there are some things that you guys need to know. And having high blood sugars is not good. And what is high? Well, we're going to talk about that. So before we get into class, I have to make this disclaimer. You guys, I'm a health practitioner. I am not a medical doctor. I cannot diagnose anybody, but once you are diagnosed, then you can come to me and I will help you to find balance in your body. So everything I teach you tonight, you always want to check with your medical doctor. However, what you're going to receive in these classes are always really good conversations that you can have with your physicians, and then come to me and I'll help you with everything else. And I thank you for being here, and that's my gift to you. So if you go to the file section in this group, you will find those books there. Okay, so tonight we're talking about, why is it that having high blood sugars are bad? We're going to talk about kind of the ranges where they should be in. We're going to talk about what is considered high, what's considered not high, all of that. Okay, but I always say this before every class, and you guys should know this by now, but it's never just one thing that causes disease or a diagnosis or a symptom. Okay. It's never just one thing. So if you have high blood sugars, people think, oh, you have high blood sugars because you're eating bad. That's just a small part of it. Okay. Our bodies are designed to be able to eat carbs. I mean, when we eat carbs and we eat sugar, our body should be able to manage that sugar, right? It should be able to, you know, eat the product, eat the food, and then our body's like, oh, there's too much sugar, so the sugar is regulated by the body's internal smartness, and the body's able to take that and do with it what it needs to do in the body. Our bodies are smart. Okay. But when you start getting high blood sugars, chronic high blood sugars, that's a symptom of something else being out of balance. So it's your body breaking down. So when you have symptoms of any sort, it could be migraines, it could be aches and pains, it could be arthritis, it could be fibromyalgia, it could be PCOS, it could be type 2 diabetes, it could be high blood pressure, it could be high cholesterol, it could be PCOS. I mean, list it all, right? it, there's just all those are symptoms of your body not being able to manage the health, right? It's your body's breaking down and something has broken down in the body, and it's never just one thing. So when I say that to you, we have different systems in our body that we have to kind of be able to understand how to work on each of these individual parts of our system, of our lifestyle. That's why I call my academy Lifestyle Coaching Academy, because we work on all these areas. So if you have inflammation, you're going to have problems. If your hormones are off, you're going to have problems. If you have a lot of stress in your body, you're going to have problems. If you're on a lot of medications, that's going to cause problems, ladies. It just is. If you're not eating right and you don't know how to eat, that's going to cause a problem. If you are taking the wrong supplements or not taking any supplements, or your body's not absorbing supplements, that's going to be a problem. If you're not able to move, if you're not moving, that's going to be a problem. If you have a terrible negative mindset or you have bad self-talk, that's going to be a problem. Okay. So it's never just one thing. So what I like to do in this group is I want to try to hit every one of those areas as much as I can for you. And I've covered them all in this group, right? Certain videos, certain classes will address one of those areas, but it's always a combination. It's never just one thing. So when we're talking tonight about why blood sugars are bad, I want you to really take this all in, because having chronic high blood sugars, okay, having chronic high blood sugars, and just so you know, any blood sugar that is consistently over 100, if you never see numbers under 100, you have high blood sugars. Okay. Now, if your blood sugars go up 100, 101, 105 every so often, not a big deal. That's not what I'm talking about. I'm talking about if you never see below 100 ever, you have got you've got pre-diabetes, type 2 diabetes, okay? Because your or insulin resistance, right? Your body is breaking down because it's not understanding how to maintain that blood sugar level. Our bodies normally maintain our blood sugars between 80 and 100. That's what our bodies are designed to do. Keep our blood sugar levels between 80 and 100 milligrams per deciliter, or that would be 4.4 millimoles per liter for those of you in Canada. Okay, so if you're not seeing numbers at all like 4.4, under 5.0, or under 100 milligrams per deciliter, your sugars are going to keep creeping up unless you start changing some of these 7 areas I'm going to talk with you about tonight. Okay, so I want to talk tonight about, and I hate to be the bearer of bad news, but you guys got to understand the dangers of having high blood sugars, having chronic blood sugars over 100. And this is what I see when people come and work with me. They have blood sugars, like in the 160s, 170s, 180s, over 200s. And that over a period of time is so detrimental to your health. It's so bad for your body. And that's what we're going to talk about tonight. We're going to talk about why. Why is it so bad having high blood sugars? The other thing I want to touch really quickly is that if you're being told by whoever, I don't care if it's a nutritionist, I don't care if it's a diabetes educator, I don't care whatever, who it is, if you're being told that 120 is okay for blood sugar levels, you are being misled and you're not being told the right information. Okay. And I'm going to show you, I'm going to prove to you in this class tonight. I'm going to let you visually see why that is. I'm going to visually show you why having blood sugar numbers chronically over 100 for a long period of time is always going to lead to worsening numbers and worsening health. Okay. Who do we got on? Hi. Hi, Charlene. She's the new one that came on. That's the thing with, I can't see on my phone everybody that's on. So anyway, there's a few of you. Okay. So I want to talk about the three main reasons why it's really not good to have high blood sugars. Okay. So the first one I want to talk about is what happens when you have chronic high blood sugars is you get micro hemorrhaging of the vessels. Now, you see this picture? These are shards of glass, and that is basically what sugar does in your body. When you have too much sugar in your body, think of it like shards of glass, okay? Just to remind you guys, our entire body is designed to only have 1 teaspoon of sugar in it. 1 teaspoon is 4 grams. 1 teaspoon is equivalent to 80 milligrams. So when you take your blood sugars and you prick your finger, if your blood sugar is between 80 and 100, 4.4 to 4.8, you're in that 80 to 100 milligrams per deciliter, or 4.4 to 5 millimoles per liter. That is where your body is designed to maintain your sugar levels. That's a healthy blood sugar level, okay? Anything more than that is not good. And so if we just have 1/4 teaspoon more, that would give your blood sugar level of 126, or that would be a 7.0 millimoles per deciliter, millimoles per liter. That is considered diabetes. So just a 1/4 teaspoon more, if you're looking at it from like a visual standpoint. Okay. So when you are being told that 120, 115, 1 is okay, it's not. And I see so many of those numbers even on medications. Okay. And here is why: because you are getting this microhemorrhaging that happens. And what happens is when you get all of this extra sugar inside of your blood, it causes tearing. So the shards of glass cause these micro tears. And then you're leaking blood into your body. And when that happens, there's a protein that is released in your body, and it's a protein called fibrogen. And this is used to prepare all of the leaks that the shards of glass have caused your body, your tissues, right? Your arteries. And so that fibrogen is what causes the blood to become sticky. Okay, and that sticky blood is the problem. So the shards of glass are causing tears, which release fibrogen, and that sticky blood is a huge problem because what's happening is that's what's causing clots. So when you have strokes, when you have heart attacks, or any sort of clotting, that's what's causing the clots, is that sticky blood. Okay, which is caused from high blood sugar, right? Also, hardening of the arteries. When you have high blood pressure, when you get diagnosed with high blood pressure, and then they start putting you on, diuretics because you have swelling and edema, that is caused by hardening of the arteries, which is caused by, again, this is a trickle down effect, right? So you're getting hardening of the arteries because you are losing the elasticity of your tissues, of your arteries. Okay. And then the last thing is when you have this sticky blood, you're losing your loss of vision. It's directly related to your vision because your retina is destroyed, and that's due to the oxygen and a lot of the blood flow that's going to your eyes. Okay. So that's the first part, is that the microhemorrhaging of the vessels is causing a lot of damage. Okay. Then the second thing that happens when you have high blood sugar is you will eventually you will get a fatty liver. Okay. A fatty liver usually is not symptomatic. Like, you don't usually feel the effects of a fatty liver until it gets to the point where it's like your liver is pretty much like damaged. Okay, there's not a lot of symptoms. I'm going to give you a tip on how you can identify if you have a fatty liver. But if you have diabetes, you do have a fatty liver. If you've been diagnosed with diabetes, you just do have a fatty liver. But a fatty liver is basically too much fat builds up in the liver cells, and that's caused by too much sugar because it adds up, and it's converting the sugar into fat in and around the liver. Okay, so when you have a fatty liver, then that also is going to be caused by insulin resistance, and insulin resistance can cause fatty liver. So it's kind of a back and forth seesaw effect. You can sometimes get insulin resistance before fatty liver, and sometimes fatty liver will cause, if you have fatty liver, you do have insulin resistance. That's just 100% how it works, right? So when you are when you're releasing insulin due to high sugar, okay, insulin is what converts the carbs into fat, and that loads up your liver. Okay, so then your liver just gets full of fat, and then what eventually happens is all of that fat and it damages the liver, and your liver starts to turn into scar tissue, and it doesn't work well, and it turns into cirrhosis. And then you will lose the function of your you will lose the function of your liver over time, because again, all the fat around the liver is causing scar tissue, which then will lead to cirrhosis. Now, I'm not talking about the kind of damaged liver you get from drinking. I'm talking about just the one that's the fatty liver that's caused from carbs and sugar. Okay. So, like I said before, when you have a fatty liver, you really don't have any symptoms. Like, you can't feel your liver hurting. There's no really symptoms of it, except here is how you know if you have a fatty liver. One, if you've been diagnosed by your doctor with type 2, you have a fatty liver, because you just do. But here's the biggest reason how you know you would have a fatty liver. If you all right now just look down, okay? If you look down and you have a belly, like you have a gut, okay, which most people who have insulin resistance do, because when you have insulin resistance, that's where you store your fat, and then that's also where the fat is stored around the liver. So if you look down and you have a belly, you have fatty liver. That is one way. Even though you might not have symptoms, okay, if you look down and you have a belly, a big belly, you have a fatty liver. That's one of the key indications of a fatty liver. So that's kind of a good test to be able to do on yourself in that regard, okay? So again, fatty liver is super important to understand what that is, and fatty liver is caused from high sugars, and you need your liver working properly, because if your liver is not working, you are unable to detox, you're unable to decrease your inflammation, which is the third huge effect of having high blood sugars, is inflammation. So when you have inflammation, type 2 diabetes, insulin resistance go hand in hand with inflammation. So if you are high sugars are going to cause inflammation, and that's going to cause insulin resistance. Okay. Again, scar tissue in the liver, that's going to cause decreased liver function. That's also a cause of inflammation. When you have inflammation in your body due to high sugars, you will have a nutrient deficiency. Why? Because your cells are starving. Why? Because insulin resistance is not getting any fuel into your cells. So why do you guys have a lot of cravings? Why do you guys feel hungry all the time? Why is it that you can't lose weight? Why is it that your doctor wants to put you on medication? Because when you have insulin resistance, okay, you're not getting nutrition in on a cellular level, and your body needs that energy, right? So that's what inflammation does. It's a trickle down effect. They're all kind of tied in together, right? So you know, you're nutrient deficient, your cells are starving, so you're not going to feel very well. And also with that, when your cells are starving and when you're nutrient deficient, another reason why, because inflammation is not allowing your body to digest the nutrients either. So you're not getting them into the cell because you're insulin resistant, and because you have inflammation, you're not able to absorb the micronutrients, the vitamins, minerals, all of that into the cell for energy. Okay. Another effect of inflammation is pain and arthritis, right? So if you have a lot of chronic pain, if you have been diagnosed with arthritis, that's inflammation in the body, okay? And if you've been diagnosed with fibromyalgia, you absolutely have inflammation. And high sugars will cause these a trickle down effect. So if you have high sugars, you have inflammation, and inflammation is plays a part in all of these things. And then the last one is, again, when you have inflammation, you are going to have a suppressed immune system. And how do you know if you have a suppressed immune system? Well, if you're sick a lot, if you have had COVID, like bad symptoms of COVID. Okay, we're all going to be exposed to COVID. I'm not going to make this turn in this class into COVID. Don't even get me started on that. But if you've had COVID and you had a real bad outbreak, like really, really bad symptoms, like really bad, and your body wasn't able to fight it off, people are dying from it. It's because they have a suppressed immune system. Okay. If you get chronic infections or you have to go on a lot of antibiotics, like a lot, you have a bad immune system. If you have getting diseases like cancer and some of these other type 2 diabetes, right? Of course. Those are some indications that your immune system is suppressed. Our immune systems do so many things, you guys. And when you are inflamed, you will be suppressing those functions. The other thing is, if you are overweight, okay? If you are overweight, you 100% are also going to be increasing your inflammation. This is even if you're not diagnosed with type 2 diabetes, but let's just say you're overweight. If you're overweight and you've had a hard time losing weight, but you haven't been diagnosed with prediabetes or diabetes, you can still have insulin resistance, which means that, again, when you have insulin resistance, the fat cells release cytokines, which are very inflammatory, which release free radicals, which cause more insulin resistance. So it's just vicious cycle. So this is one of the huge misconceptions out there. Is I have a lot of clients come to me who say, I want you to work with me, but I'm not diabetic or I'm not pre-diabetic, right? I went to my doctor and I had my labs done, and I don't have any, I'm not diabetic, but yet, I'm really overweight. I can't get weight off. I always gain it. I feel like crap. I'm fatigued. Any of those symptoms, if you're overweight and you can't get weight off and you don't feel well and you have inflammation for sure, and you're on your way to, if not already, you have insulin resistance. I work with many clients who haven't been diagnosed with prediabetes or diabetes, but they're overweight, and it's because their hormones are out of whack, and they're on the cusp of insulin resistance, and they have a lot of inflammation. So I work with them to create balance in the body so that we can make sure it doesn't develop into prediabetes. And that's the biggest thing I always try to educate my clients, especially women who are overweight, who don't think that they need to go on any sort of a program with me. I'm like, if you're overweight and you're having a hard time, it will eventually, Our bodies are resilient. So it might not be in a year or 2 or 3, but if you're overweight and you've been overweight a long time and you keep gaining and you can't lose, you eventually, that will turn into insulin resistance and prediabetes and potentially type 2 diabetes. It just will. It's the progression, right? So it's just important that you guys get a handle on that and know that, because once you figure it out, girls, I'm telling you, once you get those hormones balanced and you really understand the science behind insulin resistance, prediabetes, and being overweight, and you can work with somebody like me who can help you sort all that out, it's a beautiful way to it's a beautiful way to live when you don't struggle with this. Okay, and that's what I'm so passionate in helping you guys do. So again, a reminder, I want to remind you of this because I want you to see it visually one more time, because I think this is super important. Okay, in our entire body, we have 5 liters, between 4 and 5 liters of blood, depending on your size, male or female, but it's roughly 4 to 5 liters. Okay, in our entire body, you guys, we are only designed to have 1 teaspoon of sugar in our entire body. 1 teaspoon. Okay, 1 teaspoon of sugar is 4 grams. So if you read labels, 4 grams of sugar is 1 teaspoon. And that breaks down into, when you prick your finger, 80 milligrams per deciliter, or 4.4 millimoles per liter. Okay, so just 1/4 teaspoon more, which would be about 5 grams. That then would be, if you pricked your finger and you had 5 grams of sugar in your body, okay, your reading would be 126 milligrams per deciliter, or 7.0 millimoles per liter. Okay, so I mean, where's my graphic? Oh yeah, so let's take a look at this. So this is a can of regular Coke. Now, I know some of you don't drink regular Coke, but you could use this for anything that you read a label and you can see there's grams of sugar in it. 1 can of regular Coke, okay, has 10 cubes of sugar in it. Has like 37 grams of sugar. So 1 cube is 4 grams. So 1 can of Coke has 1, 2, 3, 4, 5, 6, 7, 8, 9, about 10 cubes of sugar. 40 grams of sugar in 40 grams. 40 grams in 1 can, which is what? Which is what? If you count how many teaspoons, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 teaspoons of sugar. Our bodies are designed to have 1 teaspoon of sugar in it at one time. So 1 can of pop has 10. And then you wonder why our bodies break down, because you load it with all of that sugar. Over time, it builds up and your body breaks down. Okay? Normal fasting blood sugars. Normal fasting blood sugars. If you do it fasting, the goal is to have between 75 and 85. Even under 100 is fine, but this is truly a sign that your body is managing sugar normally. Pre-diabetes, this is now fasted, remember. If you take your blood sugar early in the morning, I know some of you have the dawn phenomenon, I get all that, but if you take your blood sugars first thing in the morning, if it's between 100 and 125, you have pre-diabetes. We should have our blood sugars between 75 and 85. That is the goal. Okay, does that kind of like make you guys a little bit like, oh boy, what is going on, right? So when you have diabetes, though, what happens is that blood sugar is all over the board, okay? And then it's because your body is not understanding how to manage that sugar. For example, I don't have diabetes, right? And when I eat something, let's say I eat a brownie. Let's just say I had a brownie. I don't eat a brownie, but let's just say I had a brownie, okay? I ate a brownie, even though it has, probably 8 grams of sugar, let's say, okay? Again, at one given time, you don't want 8 grams of sugar circulating in your body at one time. So you eat the brownie, I eat the brownie, has 8 grams of sugar, but my body knows how to take that sugar, remove it to get it back down to 1 teaspoon. It aggressively, you guys, when I eat a brownie and I have 8 grams of sugar in my body's like, I need to get that back down to 4, because over 4 is very bad, right? So my body knows how to do that. It's balanced. it works properly. My pancreas releases insulin. When it senses high sugar, the insulin grabs onto the sugar and pushes it into my cells for energy. And then if I took my blood sugar an hour after I ate that brownie, it'd be normal. It'd be fine. Okay? What's happening with a lot of you guys who have prediabetes type 2 or insulin resistance is you eat and your blood sugars your body doesn't know how to manage that sugar. Okay? And that's just with like any food. When you eat any food, it breaks down into sugar. The only thing that doesn't break down into sugar or glucose in your body is pure fat. So even if you eat healthy foods, even though it breaks down slower, like salads and vegetables, it still breaks down into glucose in your body. But not 20 teaspoons like a piece of cake would or whatever. So I just want you to kind of understand what's going on with you guys, right? It's like when you have chronic high blood sugars, there's a system in your body that's breaking down. And then when your physician puts you on medication, what that's doing is it's just putting a Band-Aid over the underlying problem. The medication doesn't fix the imbalance in the body. It puts a Band-Aid on it. Okay, so what insulin or Januvia or metformin, what all that does is it pushes. So if you take Januvia or insulin, right, Januvia is causing your pancreas to release more insulin to try to push the sugar in. Well, if you have insulin resistance, it's not getting the sugar in. So then your body just keeps releasing insulin, more insulin, more insulin. Your sugars stay high, 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 high. So the blood sugar, the medication is trying to force sugar into an already full liver, full muscle cell, full fat cell. It's already, you know what I'm saying? So the medication isn't fixing the problem. The medication is just giving you a temporary fix. This is why so many people, when they come to me, they're like, I've been on medication and my blood sugars are still 130, 150, 160 on insulin. My blood sugars are 180 on metformin, and metformin is not fixing the problem either. And the side effects of metformin are horrible long-term. Long-term side effects of metformin are really bad. Even though short-term, it will force the cells to open up. But again, if you don't fix the underlying problem, you're going to end up having to increase your metformin, and then it just is a vicious cycle. Okay, you guys? Because having chronic high blood sugars is not good. I want to help you. I want to help you so that you don't have to worry about your blood sugars anymore. You don't have to worry about your liver. You don't have to worry about your arteries. You don't have to worry about inflammation. You can start losing weight. You can start feeling better. I know so many of you guys are frustrated and you're being told a cajillion different things. So I'm going to set the record straight. I'm going to do a series next week. You want to make sure you're there, okay? Because this is going to be amazing information.